1 year ago today, thousands of medical students from across the country came together under the banner of White Coats for Black Lives to die in.
Together we acted in public to protest police brutality against Black people and to declare that Black Lives Matter.
In the years since, we have established White Coats for Black Lives as a national medical student organization guided by 3 principal goals.
First, we seek to highlight racism as an urgent public health concern and a prevailing threat to the well-being of people of color.
Second, we work to address and dismantle racism within the institution of medicine.
Third, we work to ensure that medical students and physicians actively participate in the struggle for racial justice.
In the context of a healthcare system that has not yet sufficiently confronted clinical bias and systemic inequality, including the provision of care based on the ability to pay, people of color will continue to suffer disproportionately from preventable medical conditions and be more likely to die at younger ages.
And so, despite the legal protections that should guarantee people access to the full opportunity of our nation's promise,
despite efforts to increase the availability of health insurance in the United States,
and to further prevent the exclusion and discrimination based on background or health status,
the effort must continue.
In light of these shortcomings, we, on this day, the International Day of Human Rights, continue to challenge each other, our academic institutions, and our society to do better.
Let's make this year the year to clarify in our national conscience that racism is not over in the United States.
in 2015, Black Lives Matter.
Health is indistinguishable from safety in that all forms of threat to safety, both actual and perceived, including threat from the police, constitute a threat to health and further contribute to the burden of trauma that exists in many communities of color.
There is nothing normal or acceptable about the disproportionate loss of life in communities of color. To rationalize these disparities as natural is to be complicit with an ideology that allows for the persistence of inequality.
Young people at school and patients in hospitals should feel confident that they will be kept safe while receiving education and care. That they will be free from assault and aggravation by those charged to protect them.
No person is illegal, and that there is no morality in denying education or medical care to others based on documentation status or nation of origin.
And that interventions intended to support marginalized communities do not make for unequal playing fields, they only begin to even out what is already radically biased. In other words, efforts to ensure that all boats rise together will only serve to maintain privilege and hierarchy.
to the medical schools, professional organizations, and national associations that have voiced support of White Coats for Black Lives, we thank you. A willingness to honestly address issues of racism and inequality is a necessary start.
However, discussion alone does not undo suffering and privilege. Actions speak louder. At this one-year mark, we ask you to join us in taking stock of progress thus far. Real change requires action.
And today, together with millions of our friends, families, patients, and peers, we call out to our hospitals, residency programs, and medical schools to begin taking that action.
If you acknowledge the overwhelming cost of medical school but continue to raise student fees, actions speak louder.
If you feel that the lack of racial and ethnic diversity in medicine is an issue, but have not adopted holistic admissions policies for your school or residency program, actions speak louder.
If you recognize the immorality of providing healthcare based on the ability to pay, but your institution does not accept Medicaid patients or the uninsured, actions speak louder.
This winter, we invite you to join us in action. Within the medical community, there are many avenues for change. These include reform in student financing, curricular changes to include greater emphasis on bias and social determination, and university and community relations.
This December, we focus on 2 concrete opportunities that have the capacity to transform medical practice and training in the United States.
First, we believe in providing equal patient care independent of ability to pay. We therefore call on hospitals nationwide, and especially our academic medical centers, to end the double standards we see for insured and uninsured patients.
Second,
We believe that the medical community should reflect its patient population.
The United States population is 13% Black, 1% Native American, and 17% Latino. However, physicians from all these backgrounds represent only 9% of the workforce. Medical schools must therefore recruit, admit, and support classes that are representative of the national population.
The accomplishment of these tasks is not a matter of viability, but a matter of priority.
In 2016 and beyond, we look forward to the spoken priorities of our medical community being more fully carried out in action.
For now, we remain in solidarity and protest. White coats for Black lives.